super common muscle and joint issues among diabetics and remedies. Hi, I'm Dr. Ahmet Ergin. I'm an endocrinologist treating diabetics all day long. And I see a lot of these problems that come to me. Now, having diabetes can lead to various musculoskeletal conditions. Patients with diabetes often experience higher rates of hand or shoulder disorders, particularly with the longer duration of the diabetes, right? Now, these abnormalities in your hand, for example, or even feet, can be common due to changes in the microvasculature, which is the tiny vessels that surrounds those tissues, connective tissue itself, and the peripheral nerves, which are the nerves that are typically around that is affected from diabetes. Now, I'm going to talk about the specific conditions associated with diabetes. And number one, I want to start with Carpal Tunnel Syndrome, which affects up to 20% of diabetic patients, and the incidence increases up to 75% for those people who already have limited joint mobility. Now, there are surgical and non-surgical treatments, right? But when it comes to Carpal Tunnel Syndrome, or CTS, we've got a few tricks to tell you before the surgery. First off, the non-surgical treatments are there. They're super nice sidekicks where before you end up with the surgeon, it's going to save the day without all the drama. Now, what is that? Number one is wrist splinting. Now, imagine your hand wearing a little cozy little armor, avoiding activities, for example, that worsens the symptoms. Or, of course, sometimes the pain relievers if nothing helps, but that shouldn't be a long-term remedy. If these are not enough, it is time for that surgery to step in, the surgeon, right? So what they do is carpal tunnel release. Don't worry, it's not as scary as it sounds, but it is a simple procedure where the surgeon cuts through the ligament around the carpal tunnel to ease the pressure on your median nerve, which is the nerve that is affected. It is kind of like freeing a damsel in distress, except the damsel is your nerve. The procedure can be done by open surgery or endoscopy, or depending on the severity, the surgeon chooses what to do. Now, the next on the list is Dupuytren's contracture. Observed approximately 15 to 40% of patients with diabetes, with a higher prevalence in older patients and those with longer durations of diabetes. Now, let's talk about that a little more. I call this a hand hugger. Why? Well, this condition slowly but surely causes your fingers, usually the ring and the little finger, to bend in towards your palm. So it's kind of like they're perpetually ready for a handshake. So some people call it hand hugger. Well, this happens due to a thickening of the tissues in your palm, creating a ropey cord that pulls your digits into a perpetual fist. It's like your hand is always prepared for a thumb war. But jokes aside, this is not a condition to ignore. If it gets too severe, it could get in the way of simple tasks like picking up a cup or shaking a hand. Like, you may not release the hand and like, okay, give my hand back. So remember, folks, always keep an eye out for the hand hugger. First, let's imagine the non-surgical treatments. These are friendly, right? They're nice. They keep an eye before you get into trouble with surgery. And what are they? These are like physiotherapy or the hand splints again. Kind of like equipping your hand with its own personal security guard before things are too late. Now, if these neighborhood watch pals cannot handle the hand hijacker, it's time to call the big guns. Again, surgical intervention. This could be something called a needle aponeurotomy, where a needle is used to break apart the contracture, or an enzyme injection to soften and break down the tough tissue. Think of it as negotiating with the hijacker for a peaceful resolution, right? And for stubborn cases, there is that traditional surgery where the affected tissue is just removed. It's like the SWAT team finally swooping in to save the day. No matter how tough the hijacker is, we have got a team ready, right, for you to tackle it, thanks to medical advancements. Remember, In the world of diabetes and musculoskeletal issues, we are all heroes fighting the good fight. So, next one on the list is trigger finger, or tenosynovitis of the flexor tendon of the finger. That affects also 5 to 20% of diabetic patients eventually. The duration of diabetes is a big factor. Not controlling diabetes is a big factor, right? And treatment is similar for non-diabetic patients as well, because that happens to them too. So how do we go by that? So we like to call the trigger finger, we like to give things names, right? We're going to call it Lone Ranger. So, see, trigger finger is a condition where your finger or thumb gets stuck in a bent position, like a cowboy's hand on the trigger of his trusty 6-shooter. This happens because the tendon in the affected finger becomes inflamed and swollen, making it harder to extend the finger. Imagine trying to squeeze a cactus through a keyhole. It's not going to be easy. First off, we have our trusty deputies of non-surgical treatment squad. They're always ready to lend a hand. This includes rest, right? Telling your trigger happy fingers to take a break. Come on. Splints, another one, right? Like a mini jail cell for your misbehaving finger. And physical therapy, of course. Think of it as a finger workout. But in a specific way. You don't want to just use your finger unnecessarily. But if these deputies cannot calm down the Lone Ranger, well, that is when we call in the cavalry surgical treatments. We have percutaneous releases, where a needle is used to loosen up your trigger happy finger. And if that doesn't work, there is always open trigger finger release surgery. And again, this is more like breaking down the salon doors to free the townsfolk, or in this case, your finger. So whether it is the sheriff's deputies or the cavalry, rest assured that you can deal with that pesky Lone Ranger. Now, remember, type 2 diabetes increases the chances of developing osteoarthritis too, which is just basically, arthritis, common arthritis that everybody knows. Now, connection between these conditions is intricate, and they involve obesity, other inflammatory conditions, but musculoskeletal issues related to diabetes most of the time include limited joint mobility, neuropathy, neuropathic arthropathy, right? Bone disease sometimes, even diabetic muscle infarction, which is the muscle death. That doesn't sound very friendly, right? Now, let's dive into the world of alpha-lipoic acid and benfotiamine, how these things can help. SugarMD neuropathy support that has both, for example. Consider them as the 3 musketeers on a mission to combat the inflammation in joints and muscles. Now, alpha-lipoic acid, our first musketeer, is a powerhouse of antioxidant that fights off harmful free radicals in the body, like a knight-slaying dragons, reducing inflammation and nerve damage. And the second musketeer is the benfotiamine. It's a derivative of vitamin B1 with a special knack for managing blood sugar levels. It's like sensible friend who always reminds you to eat healthy, helping to prevent the buildup of harmful molecules. Remember, when you have diabetes, a lot of things, a lot of glucose, when it's not utilized correctly, it goes to different pathways. We talked about this before. And then they accumulate and cause all these musculoskeletal problems in the absence of enough B1. So finally, I'm going to talk about, we have the alpha-lipoic acid, benfotiamine. You can use them separately, or you can use them in combination with SugarMD neuropathy support, which has both, just because some people need more than the others. That neuropathy support we have is a specially formulated supplement designed to support the nerve health and the muscle health to reduce the inflammation. Think of them like a ninja addressing the root cause of inflammation problems. I'm not saying keep your blood sugars high and don't mind that. No, you have to keep diabetes under control and take these in addition to that. Now, these 3 musketeers, right? The benfotiamine, alpha-lipoic acid, neuropathy support, they protect the kingdom, which is your body, from the evil lord, which is the inflammation. They work relentlessly to ensure the citizens, which is your cells and your nerves, live happily ever after. All right, folks, let's do a quick recap of our muscle and joint issues in the diabetes world and how we can tackle them. First, we had the hand hugger, right? AKA Dupuytren's contractures. That makes your fingers bend in as if they are forever ready for a handshake. We saw how non-surgical treatments like a neighborhood watch walks and surgical treatments are our big guns sometimes, right, for this hijacker. And next we rode into the sunset with the Lone Ranger, or the trigger finger, where the fingers get stuck in a bent position. And again, we had non-surgical treatment methods and sometimes surgical methods as a last chance. And we talked about the carpal tunnel syndrome and how splinting the non-surgical options and surgical options are there as well. And we talked about the 3 musketeers of alpha-lipoic acid, benfotiamine, and SugarMD neuropathy support. So I hope you learned something today. And thanks for watching. Please remember to like, share, and subscribe. And I will see you in the next video. Thank you for watching.